Good morning. We have acted swiftly and aggressively in Baltimore to help slow the spread of COVID-19. Last Thursday, after Governor Hogan declared a state of emergency for Maryland, and I fully activated the city's Emergency Operations Center. Somebody's interpreting this? I got you. I thought we had an interpreter here.
That's the original stuff.
Okay. At the Emergency Operations Center, city agencies and partners are working around the clock, planning and coordinating emergency response and recovery with our community, state, regional, and federal partners to help remove roadblocks and speed up our ability locally to continue to quickly and forcefully respond to the changing threats from COVID-19. I have signed a declaration for a local state of emergency. My order takes effect at 12:01 p.m. today. This declaration will help speed up the process of procuring goods and services needed to support and protect the residents of Baltimore City and our first responders who are putting their safety on the line to protect all of us. The emergency declaration also helped unite us with our surrounding counties who are also battling COVID-19. The region's joint forces drive home the seriousness of the situation and makes real the need for all of our citizens to follow the advice and orders that will help make us all safe. The emergency declaration will also serve as an alert to our state and federal partners that Baltimore is moving to a new phase of response. On Monday night, the City Emergency Operations Center sent a request to the state of Maryland for needed supplies to help protect the city for the next 90 days. Baltimore City's government remains open and operational. The Emergency Operations Center will continue to remain fully activated and fully operational. All city resources will be focused on continuing to serve the residents of Baltimore City. We now have a total of 5 confirmed positive cases of COVID-19 in Baltimore City. Our health commissioner will provide an update shortly on where we stand. We understand that many of our residents are facing difficult burdens. That's why I took a number of executive actions in advance to help our residents. I relaxed a number of parking and towing restrictions, and I've ordered the Department of Finance to delay the city's annual tax sale. This is a global health emergency, and I need everyone in Baltimore City to adjust to this new reality. At this time, it is critical that we all follow best practice to limit exposure to ourselves and our fellow residents. This means social distancing of at least 6 feet of space between yourself and another person. Washing your hands with soap and warm water often and for at least 20 seconds. Using hand sanitizer that is at least 60% alcohol based. Don't touch your face. Clean high point touch areas often. Cough into your elbows, not in your hands. The best thing Baltimoreans can do today is stay home and not expose themselves or their family to any unnecessary risk. I would also ask that all Baltimoreans please check on your elderly neighbors. Make sure they have the medication, food, and essential they need to survive. Again, I want to stress that these next few weeks are not a vacation for our youth out of school or for residents sent home from work. This is not the time to hang out with family or friends. We must flatten the curve, and this is our opportunity in Baltimore City to do just that. Now I will turn it over to our Health Commissioner, Dr. Leticia Sarasa.
Good morning. Thank you, Mayor Young, for your leadership, and thanks to my colleagues and our partners for their support. Now, as the Health Commissioner, I have to ask this group to my left to try to spread out. It is making me nervous. 6 feet. Okay. Because that is the message that we want to promote. Mayor Young has mentioned it, but I cannot stress enough the importance of social distancing. As Mayor Young indicated, currently Baltimore City has 5 confirmed COVID-19 cases with evidence of community transmission. All cases are noted to be in good to stable condition. At this time, it's important to note that the city's response is focused on community mitigation. Our focus on community mitigation is in an effort to decrease the potential for further spread of COVID-19 to residents throughout our community, with a particular focus on those that are at highest risk for severe complications from COVID-19, including our adults over the age of 60 and those with underlying health conditions such as heart disease, lung disease, or diabetes. Accordingly, I want to take a moment to review 3 major points today. First, not every person requires testing or evaluation by a physician for the onset of mild symptoms. Second, personal protective measures remain an important way to limit the spread of respiratory illness. And third, social distancing is paramount to protecting the health for our most high-risk residents. Regarding testing, we recognize that this message has shifted over recent weeks. It may change again. As of today, there is a limited number of tests available for our community. We anticipate this number to increase in the coming days to weeks. However, given our current capacity to test, we currently advise the following. Not everyone needs to be tested, nor is there availability for everyone to be tested at this time. Therefore, people with mild symptoms of fever, cough, and shortness of breath should stay home and not go out to decrease the risk of others getting sick. You should remain isolated at your home until 1, you are without a fever for at least 72 hours without fever-reducing medications, and your other symptoms have also improved, and at least 7 days have passed since the onset of symptoms. While at home, you can manage your symptoms by rest, hydration, and medication as needed for fever. If you are over the age of 60 or have underlying medical conditions such as heart disease, lung disease, or diabetes, and if your symptoms worsen and you develop worsening shortness of breath, chest pain, or other concerning symptoms, call your doctor or 911 immediately. The criteria I just outlined around how long to stay at home can also be found at cdc.gov. Again, I will reiterate, the recommendations to seek testing may change in the future as testing becomes more widely available. Secondly, personal protective measures remain an important mechanism to reduce the transmission of respiratory illnesses. This includes frequent hand washing with warm water and soap for at least 20 seconds, or use of an alcohol-based hand sanitizer that is at least 60% alcohol. Avoiding touching your face, eyes, nose, and mouth. Avoiding touching frequent touch points like elevator buttons or doorknobs. Cleaning high touch point areas such as elevators and doorknobs with CDC-approved cleaners, washing your hands after being in public, coughing or sneezing into your sleeve or a tissue and throwing that tissue away and washing your hands afterwards. As important as personal protective measures continue to be to prevent the spread of COVID-19, I cannot overstate the importance of social distancing as we enter this phase of our response. Social distancing is a means to help do what experts call flatten the curve, which generally refers to the potential success of social distancing measures to prevent surges in illness that could overwhelm our healthcare systems. At the city level and in accordance with the state and the CDC's recommendations, gatherings of over 50 people are prohibited, and generally the recommendation is to avoid large gatherings as much as possible. Social distancing is the most important step everyone in our community can take at this time to decrease the number of people who become ill. Social distancing, again, is intended to slow down the outbreak in an effort to reduce the chance of infection among our highest risk population and reduce the burden on healthcare systems and workers. If you must go out, please stay at least 6 feet away from others. Even if you are not a high-risk individual for developing more severe disease, you may inadvertently spread the virus to a loved one who is at risk. Please use your best judgment and institute social distancing. We all have a responsibility to keep our community healthy. Your social distancing behaviors and the social distancing behaviors that we as a community implement right now will determine what path this takes. We must protect our healthcare systems and ensure they don't become overwhelmed. We must also protect the lives of the ones that we love. Thank you. I will now turn it over to Chief Ford.
Thank you, Dr. Sarasa. Good morning, everyone. Since the first case of COVID-19 hit in Baltimore City, the fire department has continued focusing on the safety of our community and the safety of our members. To that end, as it pertains to our members when arriving to a call that indicates it involves a patient under investigation, a PUI, a response to a call that requests personal protective equipment, PPE, a call to a nursing facility, assisted living or senior care facility, and or if our EMT firefighters or EMTs or paramedics respond to a call involving a patient with a fever or signs of lower respiratory illness, they are required to wear their N95 masks, gloves, and goggles prior to entering the patient's home or the facility. The safest precautions have been communicated to all members while we continue to help limit exposure by washing hands frequently, covering mouth and nose with a tissue when sneezing or coughing, avoid touching eyes, nose, or mouth, and to protect and practicing good health habits. Furthermore, fire apparatus and medic units will be cleaned and disinfected prior to being placed back in service. Conjointly, we want to protect the community and the members from COVID-19 and to continually provide quality service. We are also checking in on our community supermarkets and food establishments and their management to identify any emergency needs. We also want to be sure that residents are only utilizing 911 in true emergencies. If residents must call 911 for help, we urge them to provide as much information as possible and promptly so the correct resources can be sent to the call. The fire department is operating as normal. The men and women remain vigilant and ready and continue to serve Baltimore's community. Our staff remains ready. The fire department continues to communicate with Seattle and other impacted cities for lessons learned from their outbreak early on. We have been incredibly proactive about dealing with COVID-19 and was one of the first jurisdictions to implement a corona screening procedure. Now I'd like to bring forward Assistant Chief Steve Savela, Acting Director of OEM.
Thank you, Chief. Since last Friday, the city's Emergency Operations Center, or EOC, has been fully activated and operational. 3 of our top emergency management experts from the fire department have been assigned to lead the corona fight for the city. Myself, Chief Wallace, and I have been the ones. The Emergency Operations Center is managing and requesting resources to ensure our first responders have the supplies they need and are required for the next 90 days. We will remain operational and ready 24/7 through this emergency. Thank you. Now back to the mayor.
Thank you all for your hard work and dedication to the people of Baltimore. Have also asked Commissioner Harrison to join us today to provide a public safety update. Before we hear from the Commissioner, I want to reiterate how completely unacceptable the level of violence is we have seen recently. We will not stand for mass shootings and the increase in crime. We will not stand for this level of violence, and I've instructed Commissioner Harrison to do everything in his power to combat this crime. We're dealing with the Kovan virus, and those of you who want to continue to shoot and kill people in this city, we're not going to tolerate it. We're going to come after you, and we're going to get you. We cannot clog up our hospitals with their beds, with people who are being shot senselessly, because we're going to need those beds for people who might be infected with the coronavirus. And it could be your mother, your grandmother, or one of your relatives. So take that into consideration and put down the guns.
Thank you, Mr. Mayor, for your leadership. The level of violence in the city over the past few days is, as the mayor said, and we all agree, is truly unacceptable. Since Friday, we've seen an uptick in violent crime, to include 7 victims who were shot last night in the Madison Park neighborhood. What we know right now is that 5 of the victims were transported from the scene by medical personnel, and 2 other victims were dropped off at a local hospital by private conveyance. All 7 victims are in serious but stable condition. We are looking to locate a vehicle of interest which has been described as a silver Honda that was seen in the area. We're asking residents, if you have any information related to this case, to please call Metro Crime Stoppers at 1-667-LOCK-UP. One of our police officers was on patrol in that microzone during the time of this incident and actually engaged with an individual believed to be the suspect as he was fleeing the scene, which is a testament to the officer's dedication and bravery, because our officer was not armed with the level of deadly firepower that this individual had. The officer did discharge his weapon, but it is unclear at this time if the officer struck any suspects. The officer experienced some very minor injuries but has been treated, and in response, the department, as always, is adjusting to these variations in crime. While enhancing staffing in the areas have seen an increase, our department continues to work with our law enforcement partners, local, state, and federal, to increase visibility. And we are working with communities to identify and to apprehend these violent offenders. This incident remains open and under investigation. And again, we're asking residents, if you have any information related to this case, to call Metro Crime Stoppers at 1-866-7-LOCK-UP or contact our homicide unit at 410-396-2100. Thank you.
Thank you, Commissioner. I want to reassure the residents of Baltimore City during these uncertain times that you can count on the Baltimore Police Department to answer when you call and show up looking to help you. A key priority with our move into a state of emergency is the expansion of our current capacity to ensure food access for Baltimore's children and family, and to more tightly align and coordinate our efforts so that no child or family is food insecure during this time of uncertainty and limited mobility. I have convened a team of key agency and community partners to make this happen, and all of their work is coordinated through the city's Emergency Operations Center. At this point, I'd like our Food Policy Director, Holly Freestadt, to give an overview of our far-reaching efforts.
Thank you, Mayor. I'm Holly Freestadt, Food Policy Director for Baltimore City. I want to provide you an overview of the city's emergency food response to COVID-19 to make sure our food insecure residents get the food and meals they need. This effort requires the collaboration of multiple city agencies with critical nonprofit, community, and federal partners. Our emergency food insecurity response evolved from our working group that includes 9 city agencies and 13 nonprofit partners. Our purpose is to ensure that we have a strategic, coordinated approach to provide coverage and expand and maximize the number of food distribution sites across the city. The Emergency Food Insecure Response Team is meeting multiple times a week to share critical updates and real-time needs with one another and city leaders. We are adapting, developing, and expanding solutions and strategies to provide access to vulnerable food insecure populations. The 3 priorities of this response team are to provide meals to children and families, older adults, and other food insecure residents. This team approach is absolutely essential because federal funding and programs to feed children and older adults are very decentralized by nature, with many agencies and organizations providing food to these targeted populations. On Sunday, March 14th, the Department of Planning developed an interactive map for the public that shows food distribution sites details across the city. This map, as of this morning, has had over 4,500 views. On Monday, day 1 of the emergency food response, we had over 60 sites distributing 2,000 free meals to Baltimore City residents. Through partnership and collaboration, we are rapidly scaling up our efforts and increasing daily the number of sites and meals distributed. We will also be expanding sites that serve food insecure adults with or without children. I am excited to share the city's revised Baltimore COVID-19 food distribution map, which provides real-time food distribution sites, their locations, and up-to-date information. It is housed on the Health Department's website under COVID-19 and can also be accessed through numerous agency websites. Starting today, we will also have a designated 311 line for food inquiries. Whether you are a resident looking for food distribution sites, a restaurant wanting to donate food, or a community member wanting to volunteer to support our emergency food response efforts. There has also been a tremendous response from the community, with neighbors helping neighbors and grassroots organizations assisting those in need. We are coordinating across more than 20 organizations to ensure that our food insecure populations don't face any additional challenges or burdens. And I truly want to thank all these partners and city agencies for coming together so quickly and mobilizing in this crisis to feed as many food insecure populations as we possibly can. Now, I would like to introduce Tisha Edwards, Executive Director of the Mayor's Office of Children and Family Success, who is point on our emergency food response for children and youth. Thank you.
Thank you, Holly. We are ramping up and expanding our emergency food response for children and families. We have a high concentration of poverty in our city, and we must make sure vulnerable families have what they need to get through this very challenging time. Our current emergency food response for children and youth has 3 main components: grab-and-go sites at schools, grab-and-go sites at rec centers, and grab-and-go sites and mobile deliveries operated by the Housing Department, which includes community-based sites and mobile routes with delivery stops. We started the week with 10 school-based meal distribution sites. As of today, we have 17. I want to thank Dr. Santelises for ramping up the school-based food distribution program. We consider schools to be a critical resource for meeting the far-reaching needs of our city. The school sites will operate for the remainder of the week. Then next week, which is the new spring break for our students, we will shift to a more robust, community-based food distribution program. Through a partnership with Rec and Parks and the Family League, we have activated our 40 rec centers to serve as grab-and-go sites for children and youth. We have streamlined our food distribution model so that young people can pick up a full day's worth of food in one visit. Starting today, the Department of Housing and Community Development is adding 3 mobile routes to our food distribution lineup for young people. Each route has 5 stops. Monday, the Housing Department will add 5 community-based grab-and-go sites to the effort. Between the mobile routes and the community-based sites, Housing will deliver a minimum of 750 breakfasts and 750 lunches a day, with capacity to deliver up to 5,000. We are aggressively pushing to scale up this effort, while also being very mindful of all the public health requirements associated with social distancing. We will also continue to share real-time updates on the map that Holly referenced through our many communication channels. I am confident that we will meet the critical need of ensuring no child in Baltimore will go hungry in the days and weeks ahead. And in closing, I'd just like to acknowledge those partners that are here today who are supporting this important effort.
Oh, the health department. Oh.
Good morning. My name is Hyung Tan. I am the Deputy Commissioner of Aging at the Health Department. I'm going to provide a brief update of our food efforts for older adults. In this current emergency, we're most concerned about older adults in Baltimore City who are vulnerable, who do not have access to food. Our priority areas to provide food for people over 60 are people who live alone, who have disabilities, have limited access to food, and do not have a family member in the area to help them. This week, our focus has been on older adults who are living in residential senior housing, where we've provided frozen boxed lunches to residents. We've increased efforts in home-delivered meals to homebound individuals, provided support for online delivery systems through the virtual Baltimore Market program at the Health Department, and fielded many calls to the Maryland Access Point for information and assistance. Specifically, For the congregate meal sites, we have designated our 7 city-operated centers as pickup points for our participants to come pick up boxed meals. Starting next week, we are moving to frozen meals so that individuals will have a week's supply of food to take home with them. In addition, we are providing lunches to older adults in senior apartment buildings that have been designated as congregate sites. These are for residents living in senior housing. Altogether, lunches this week we've provided nearly 1,000 meals to residential sites each day. Home delivered meals are offered by our partner, Meals on Wheels. Here with me this morning is Executive Director Ms. Stephanie Archer-Smith of Meals on Wheels. Yesterday, they delivered nearly 1,500 meals to individuals who are homebound. They are beginning to see an uptick in application of added resources to intake the department to continue the main goal of fielding food applicants within 48 hours. Meals on Wheels have also expanded the grocery assistance program for people who've purchased groceries online, and they can now pay with credit card or cash with no delivery fee. Those participants who match with a voucher who can pick up the groceries for them can bring them home. Our virtual supermarket program has seen an uptick also for meal deliveries. Yesterday alone, we were able to deliver 150 groceries to 9 senior buildings. Our Maryland Access Point, we recognize that the COVID-19 situation continues to impact people in need. Any city resident who has questions on which programs they are eligible for or for resources, please call our Maryland Access Point and they can talk to someone live who will direct them to the appropriate resources. This Maryland Access Point, thanks to our partnership with United Way 2-in-1, is available 24 hours a day for older adults and caregivers. I now am going to introduce Mr. Carmen Del Garcio from the President and CEO of Maryland Food Bank.
Good morning. My name is Carmen Del Garcio, President of the Maryland Food Bank, the largest charitable food provider in Maryland. Under normal circumstances, we're distributing over 100,000 meals a day through a partner network across our state. In the city alone, that was 9.5 million meals last year. But clearly, we're not in normal times. Right now, our team at the Food Bank is dedicating significant resources so we can be in the strongest position possible to respond to the impact this COVID-19 crisis will have on food insecure Marylanders and their families. As second responders, we're working hard to continue core operations amidst this public health crisis. Food will continue to come in and come out of our doors to ensure those most in need will have access to it. To do that, we're buying food by the truckload. We're ensuring our shelves at the food bank and the shelves of our partners are stocked to serve their communities for months to come. The food bank is continuing to operate its normal food distribution programming, realizing, however, they're going to have to do it in a very customized way, community by community. But we are encouraging our partners to remain open because our best option is to keep our existing programs running. We're in constant communication with our partners, keeping them updated with the latest information, capturing best practice from around the country, including recommending various safe distribution practices like cutting back on large-scale events, distributing more pre-bagged food, and doing client intake information on a verbal basis. We're also contingency planning, given the constantly changing scenario that exists. Our operation team and volunteers are assembling backup boxes. Boxes that are filled with our most desired items: pasta, peanut butter, canned tuna, canned vegetables, chicken. These 30-pound boxes are designed to offer nutritious, non-perishable staples to last a family of 4 for a week. These boxes will serve as a backup in situations where our programs and regular distribution channels are no longer available. In the meantime, we are continuing to remain open and working with their partners to find creative distribution solutions. While schools are temporarily closed, we'll continue to distribute food to existing school pantries and remain in close coordination with that staff. As mentioned, we're distributing grab-and-go meals as well for students at select sites across Central Maryland that typically host summer programs. We've been there for some senior sites who are providing more than double the amount of food they might need to ensure senior residents have access to food for the foreseeable future. The work we're doing is designed to keep food insecure individuals and families from going hungry during this crisis. The Maryland Food Bank is here to serve all Marylanders all year long, regardless of age or background, but especially during this time of heightened need. We could not do that work without the support of Mary Young and the Baltimore City Council, We appreciate the coordinated response that we're receiving from the Mayor Young and his administration to make this possible, and we look forward to working together with the city to manage through this crisis. Thank you very much.
Thank you to everyone for keeping the focus on this important issue, and thank you, Carmen, and the Maryland Food Bank for over 40 years of fighting hunger in Maryland. I have also asked President of BDC, Colin Talbert, to join us to update the public on our outreach to the small business community. Colin.
Thank you, Mayor Young. Good morning. This pandemic is having a major impact on our local small businesses. The Baltimore Development Corporation is working closely with the mayor and the Maryland Department of Commerce to communicate current regulations and operating procedures as they are announced. The Maryland Department of Commerce's website, businessexpress.maryland.gov, has a list of coronavirus outbreak resources, including information on unemployment insurance benefits. Our website is www.baltimoredevelopment.com, and we will continue to post key information as it becomes available. We are in the process of developing a COVID-19 fact sheet for Baltimore City small businesses on how to access resources as they become available. That will be posted on our website. BDC staff members have proactively contacted over 70 small businesses. BDC has also issued an online survey for businesses and organizations impacted by the virus. We've had over 100 small businesses complete the survey to date. The most impacted businesses are restaurants, bars, event venues, personal services, and entertainment hospitality related businesses. But the impact is becoming much more widespread as time continues. Overall, businesses are reporting an average of a 65% decline in revenue, but many are completely shut down. Based on the survey, businesses anticipate having to reduce their employment by nearly a third if this situation can persist much longer. Many have already laid off workers. On Monday, at the mayor's request, BDC submitted the required forms for the governor to request a designation making Baltimore City eligible for Small Business Administration (SBA) assistance. We anticipate the governor will make that formal request to SBA today. With the designation, the SBA will work directly with states to provide targeted low-interest disaster recovery loans to small businesses and nonprofits impacted by COVID-19. These economic injury disaster loans will offer up to $2 million in assistance to help bolster small businesses. The loans may be used to pay for fixed debts, payroll, accounts payable, and other bills related to the impact of COVID-19. For additional details, along with the application procedures, please visit sba.gov. Local businesses are encouraged to complete our survey, which can be found again at www.baltimoredevelopment.com. This will not only allow us to know what's happening in real time, but enable us to communicate directly with small businesses about federal and state resources as they become available. We are encouraging residents to spend on carry-out meals and other local services to the extent possible to help support businesses during this time. Thank you.
Thank you, Colin. And I want to encourage all businesses to complete the survey to better inform us as we move forward. And I just want to reiterate that Baltimore City is functioning. Those who are teleworkers must be working from home. But all other city agencies and employees are working, and the city is moving to do the functions that we need to be doing. Now we'll take a couple of questions.
Mayor, considering that at the state and federal level that emergencies were declared last week, why did the city wait until today to make that declaration locally?
Because we get all of our information from the CDC and the Maryland Department of Health, and the governor fortunately did it a couple of days ago, so we're following the lead of the state.
So what does it enable the city to do that it couldn't do otherwise?
Well, we're doing everything that the governor has said. The only difference was the governor was able to shut down venues, something that we wasn't able to do, and shutting down schools, which is the CEO's responsibility, but the Maryland State Department of Education closed our schools. So we're doing everything that we can to make sure that people in the city of Baltimore remain calm and also take this epidemic seriously. But we're doing everything humanly possible, and it doesn't matter when I did it, I did it.
Do you plan to hold these briefings?
Just want to point out the fact that I think we were the first agency, the first municipality to stand up the EOC. And by right of us doing that, we were trying to get ahead of any emergency needs in the city. Gave us about, even though the mayor didn't declare an emergency, he was already putting everything in place to facilitate us moving forward with that.
When did the EOC open?
The EOC opened about, last Friday, but we was in discussions long before that, and our health commissioner, way back in January, I think was it February or January? February, I had already had press conferences to talk about what we were going to do to get prepared for this. So Baltimore was one of the first that I'm aware of, local governments that really took this seriously and started working on what we're going to do to try to stem the tide of this coronavirus.
We only got a couple more questions.
Do you plan to hold these briefings more often? We're hearing from the governor.
As we get more and more information, yes, we will hold briefings as we get information. If there's no new information, we won't be holding them.
Could you
But as
give us
information
more
comes.
detail about the cases that you know of that are confirmed in Baltimore
The
City?
cases that are confirmed in Baltimore City, I'll let the health commissioner speak to that because I don't know who they are or where they are, but I know that they are confirmed.
I'll speak very generally as we want to protect the privacy of those patients. So 5 confirmed cases. One is an older adult in their 60s, one is an older adult in their 70s, and the other 3 are younger adults in their 20s.
And do you have any, are the 3 younger ones connected in some way that you know of?
I will speak generally, and that's all I'll share for right now.
All right, last question. We got to get going, guys.
What is the evidence of community transmission?
So when we do our contact investigation, we're asking to try to understand travel history as well as who the case may have been exposed to. And based on that contact investigation, it's clear that there's been community transmission.
All right, thank you guys.